Hi, it's PT Cindy with Body Fit Physical Therapy. We are going over today in my video series, is it a toy or is it a tool? And going over the foam roll and different types of foam rolls, whether they have bumps on them or no bumps, whether they're really hard like a PVC, or even if they are cut in half like this one is here. So we are going to go over this particular one first, the one with the bumps. Is it a toy or is it a tool? Or even is foam rolling a toy or tool? It's become very popular, and I actually do advise my patients to do foam rolling pretty much every day. We have discussions about what it can do for them. So the big question then is, if I think it's something that I would use for my patients, I probably don't consider it a toy. It is a tool. But whether and how we use these, whether we use them in certain parts of our body, whether we use bumps or no bumps, is really what the question is. So to go over that, this is one with bumps, obviously. And what I do like about this particular one is it is softer. The bumps actually kind of like depress a little bit. So I do like the idea of rolling on something that has some bit of give to it. I don't believe in rolling that you cause a lot of pain when you roll. I don't believe you need to go to something like a PVC to get the benefits that you would need from rolling. Foam rolling really is like a self-massage. It massages the tissue, it will massage your muscle, skin, fascia. It will give some relief of some pressure there by giving you a self-massage. It will relieve some trigger points in that process. It will create a relaxation response because it's supposed to actually feel a little bit good. You want it to be strong but comfortable. If you go beyond comfortable and you make it uncomfortable, then you are actually creating a situation where your body is thinking what you're doing is a threat. So your nervous system will not necessarily allow the tissues to relax or allow even your body to relax. I like to use foam rolling prior to stretching. So if you've created so much pressure and so much pain from foam rolling that your body considers that that's a threat, then when you go to stretch a particular muscle group, the likelihood is that it will not relax. So we don't want to do any kind of foam rolling that's painful. I don't believe in mashing anything or creating that much pain that you're wincing and bracing. If you are, you're probably not relaxing. You're not relaxing and your tissue's not relaxing. So I do like foam rolls. I don't mind them having bumps or no bumps as long as they have a little bit of give to them. I use different types of foam rolls. I have this one here, which has a little bit of give to it as well. So again, pick out what you feel comfortable with, whether it's something that's softer or a little bit harder. Some people do find the PVCs, they do graduate to that because they find that it's still comfortable, but it applies a correct amount of stretch that is to the muscles, and that's fine. If you find that it's too much for you to be on top of a roll, then you can also pick to do something a little bit smaller that has less height to it. So these are nice to use in different variations. I do like that the roller when they're a little bit longer because we can lie on these and do more because of the length. So this particular one I actually carry in my office for my patients to purchase if need be. So my determination on rolling is it is a tool, it is not a toy, although unfortunately, if you don't use it, your kids will use it as a toy to hit each other with it. And that is one of the problems that we have with foam rolls that are laying around the house, is if you don't use it, they do become toys. So if you do have a foam roll and you'd like to learn how to use it, you can head over to more of my videos where I go over how to use foam rolling. So have a good night. Thank you.